It makes it safer for patients, it makes it safer for staff, and it means we can track the transmissibility of the virus.
You must stay at home.
Whatever it takes.
We will beat the coronavirus, and we will beat it together.
It is April 30th, which means it's increasingly likely that the Health Secretary Matt Hancock has missed out on his opportunity to hit his promised 100,000 tests a day target by the end of the month. Now, early this week, we know that limits on who could be tested were loosened. But Dr Hilary, is this a case of too little, too late?
Well, it would have been lovely if we'd had a huge number of tests at the beginning. I don't think any country in the world had sufficient tests because no one saw this virus coming. What we have done, and I think credit where credit's due, we've produced hundreds of thousands of tests very quickly with limited reagents and limited laboratory equipment. And yeah, of course, we could always look back and say we should have done better, and perhaps we should. But if the situation now is apparent for us all to see, we can see that we've got the usual testing in hospitals. We've got drive-in centres ramping up to about 50 around the country. We've got mobile units going into various care settings. We've got tests being delivered by the Army to care homes for the residents and the staff. And we've got drive-in centres. So we have now got increasing numbers of tests, which will be very important as we approach the phasing out of lockdown.
How much does an effective testing regime like the one you describe actually make in terms of reducing the numbers of deaths from this virus?
Well, what it means is we can identify which people are positive for Covid-19 and capable of transmitting it to somebody else. It means if someone's got symptoms which aren't clinically obvious to be Covid-19, we can take them off the front line where they're capable of infecting patients, and we can ask them to self-isolate, and we can test their household members too to see what progress they make. It makes it safer for patients, it makes it safer for staff, and it means we can track the transmissibility of the virus. So we track, we test and we track and we trace, and anyone in contact with someone who tests positive, we can ask to self-isolate as well. And by using tests and these other measures, hopefully we can reduce the number of cases that we're seeing. So we could have done better at the start, but right now we're on target to do more than South Korea, more than Germany, and this will help us to avoid a second peak, which would be very depressing for everybody.
Let's go straight into our brilliant questions from you. Thank you for sending them. Sandra Biddle says, why aren't the Nightingale hospitals full?
Well, thank goodness they're not full. If the Nightingale hospitals were also full, along with the hospitals, we really would be in trouble. They were always designed to be overspill for patients who weren't the most sick, that have to be cared for in hospital, but they were there as overspill to cope with moderately sick patients that could be nursed in a much bigger environment than hospitals that were struggling to cope with the severe cases. So the Nightingale hospitals were designed for people with perhaps respiratory distress or one organ failure, if you like, whether it was liver disease or kidney disease as a result of Covid-19, but they didn't have the same sort of facilities that you would see in an intensive care unit in a hospital. For example, some didn't have kidney dialysis to start with. So it's good news, really, that they're not full. And we just have to wait and see what happens after lockdown to see if we get more cases, in which case, because we know that Covid-19 patients can take a long time to recover in hospital, that we may need the access to more beds, more ventilators, more oxygen, more kidney dialysis in Nightingale hospitals. But the hope is that we'll never use them. Currently, there are a small number of patients there, and they're doing a great job, but we've got them there just in case.
Great news. Julie Welsh says, why do they say wearing a face mask won't prevent you contracting the virus, but will prevent you infecting others?
It's a good question. It sounds a bit paradoxical, doesn't it?
Yeah.
If someone's coughing and sneezing, they're expelling large droplets of liquid from their mouths and throat. But if you're wearing a mask, the mask will trap the larger droplets and help protect other people. Of course, if people are coughing and sneezing a lot, they shouldn't be out in public anyway. They should be self-isolating. But just suppose they are out and they're wearing a mask. The mask will trap the big droplets and protect other people. In terms of the other people, if they're wearing a mask, they've got no symptoms, they feel well. These little droplets may be circulating, but they're unlikely to travel as far as the 2 meters, which we say is a safe distance for physically distancing. So if you're wearing a mask, the air is coming in through the top of the mask, through the sides of the mask. You're putting your hands to your face. You're probably not washing your hands. You put the mask on. There's very, very little evidence that if you're just going out in public, that a mask will stop you from picking up. There's very little evidence, rather, that it helps anything at all. However, if you go to a closed environment, to a shop, for example, or a pharmacy, or anywhere that you have to go where you can't physically distance, then wearing a mask might have a little bit of value, and that's what generally the consensus of opinion is today.
Very good question here from Robert Wiley. And Robert says, does every person with underlying health conditions get severe illness if they contract coronavirus? Or can they just get a mild case despite their health problems?
It's a very good question, and the answer is encouraging that no, not everybody with a pre-existing condition will suffer severe consequences from Covid-19 if they're unlucky enough to contract it. We know of many cases where people have had chemotherapy or have already got cancer who have experienced Covid-19 and had fairly mild to moderate symptoms. Having said that, of course, if someone has suppression of their immune system because they're on medication for, say, autoimmune disease, or say they're having cancer treatment, or they've got HIV, then they may well be at greater risk of severe consequences. So that's why we put them either in a vulnerable group or in the high and at-risk groups. It's better to be safe than sorry, and therefore we are saying to them, self-isolate for the 3 months.
Dr. Hilary, let's end on a positive note. Do you have a birthday message for Captain Tom Moore, who turns 100 today?
Absolutely. He's an absolute inspiration. He has tapped into the spirit and the mood of the nation and has raised £30 million for NHS charities. And I think the whole nation takes their military cap off to him, as it were, and salutes him, because he has achieved wonderful things. His spirit is enduring and wonderful, uplifting and heartwarming. And I would say to Tom, happy birthday, and enjoy many, many more, because you have inspired the nation, and we just think you're terrific.
Yeah, we need you, we need the Queen, and during this crisis we also need Dr. Hilary Jones. Hilary, thank you so much for your brilliant work this week. If you have a question for Dr. Hilary, use the hashtag on any social media platform, Ask Dr Hilary. You can also submit your questions at thesun.co.uk/Dr Hilary or talkradio.co.uk. Hilary, have an amazing weekend, and we'll speak again on Monday.